And it was called mixed edema because there wasn't water in there. It was more mucinous looking pathology. And so mucus edema is just a thickening of the skin. It starts in the upper arms and around the shoulders. Then it likes to go in the neck area and face and obscure the jawline. And when you see that, it's an indicator that there's underactive thyroid for some reason. Okay. But on the skin of the heels, it'll just be thick and dry, I think because of where it is and the friction applied to that area. Other parts of the body will just be thick. Constipation, just because of slow motility. But I've seen elderly people with hypothyroidism that have diarrhea every day. And maybe it's just because their digestion is terrible. They can get heart palpitations. And in the hypothyroid patient, as I discussed in the adrenal lecture last week, these palpitations are more often at rest and felt at night. And that's probably because their adrenaline is kicking in at that point for them. You might see heavy prolonged menses. You will likely see infertility. A lot of women that are hypothyroid and unidentified will have recurring pregnancy loss. They may get pregnant okay, but they may have recurrent miscarriages. Or they just won't be able to get pregnant in the first place because their uterus never develops a lining properly. You can see altered sweating, usually decreased ability to sweat because they don't generate enough heat to need to sweat, but sometimes they sweat profusely because of the adrenergic overstimulation. Okay, so they could go either way. Heartburn or dyspepsia is very common, and that's usually because of underproduction of acid, which takes a lot of energy all day long on a cellular level. And then the digestive problems that can occur due to that. They may see undigested food in their stool. They may have altered bowel regulation, just a chronic feeling of bloating because the microorganisms are digesting their food for them, things like that. Allergies, asthma, recurrent infections all become more common because the immune system just is not functioning right in a lot of them. And you can see hypertension. I'm not 100% sure why, but I like to think of it as maybe there's a thickening effect in the arteries that's going on, just like thickening of all these other tissues. And plantar fasciitis and a bunch of others. Plantar fasciitis is quite common in hypothyroid patients. So getting fat without eating. This is one of those clinical points to bring up. When you get women coming in and saying, I keep a diet diary and I count all my calories and I'm exercising and I'm eating, 800 calories a day and I'm still gaining weight. I don't understand how that could be. My training in conventional medicine was just to think that they were lying to me and that they weren't really tracking their calories properly. But if you think about the physics and chemistry of this, a calorie is the amount of energy it takes to heat 1 gram of water by 1 degree Celsius. Okay, so a calorie is a measurement of heat derived from your food, heat energy from your food. Okay, and a pound of fat represents, let's say, 3,500 of these calories, as described. Restricting your calories to 500 a day, less than your expenditure. So if you have a calorie deficit based on your food, or a calorie excess with your activity of 500 a day, you should lose a pound a week because that's 3,500 in a week. And 80 to 85% of your daily calorie usage is your basal metabolic rate, the stuff that you can't really influence with exercise or activity. So the bulk of your success or failure with your weight loss in terms of calorie in and out is your basal metabolism, not your activity. And so what if your body temperature is 2 degrees lower? So it's not Celsius in this case, so it's more like 1 degree Celsius, right? So let's say you weigh not 200 kilograms, but if a woman weighs 75, 80 kilograms, which is, 80,000 grams, and her temperature is 1 degree lower, that is a lot of calories that she is not needing every day in order to generate heat for that body mass, okay? And that is why that they will gain weight even on what seems like extremely low caloric intake. It's basic physics. You can't really count calories accurately for a human being. There are too many variables. But this is a reality for some of these people. They restrict their calories, they still don't lose weight because they just don't need them. Their body is cooler. Okay, I've talked about this a number of times. Some of your hypothyroid patients look hyperthyroid because of either adrenergic compensation or just alterations of physiology based on the tissue function in question. Some of the benefits, therefore, of thyroid therapy are, of course, to reduce and reverse all of these other complaints that we just talked about previously. So let's talk about cardiovascular disease risk. And I'm going to talk about this in 2 different ways. With hypothyroidism, there's cardiovascular risk, and with overdose, there's cardiovascular risk. So this is one of the clinically relevant things to get into. So in euthyroid subjects, based upon their labs being in the reference range, T4 and TSH in this study, that had coronary disease based on a coronary calcium score. Okay, so these are people who we don't think have thyroid problems, but have plaque in their arteries. Patients with calcium scores